Good morning, everybody. Time now for Your Health, presentation of medical pharmacy and wellness on, whoops, look, there's the sunshine out there this morning, right now. I hadn't had a chance to see that today.
Yeah, it was bright walking up here. All this rain they're calling for that we haven't gotten yet, but that's okay.
Not yet. All righty. We got a subject coming up.
We do. We're going to talk a little bit about insulin and why no one checks it. And maybe it's something you should request being checked on your normal lab work that you get done.
Insulin. Which is, when I think insulin, I think of what's being injected for those that are diabetic.
Correct.
But you're just adding to the insulin when you do that.
Correct. So obviously insulin is your hormone that is released from your pancreas when you intake sugar. Mm-hmm. And so repeated intakes of sugar, which is rampant in the foods that we eat in this country. Everything has added sugars to it, even your chicken broth and most bacon products. Don't have any idea why you would ever want to put sugar on bacon, but they do. Right? Like chicken broth. Why do you need sugar in chicken broth? You don't need sugar in chicken broth and beef broth, but you gotta, if you buy store-bought broth, what a lot of people do, I make my own most of the time, it is difficult to find broth that has no added sugar to it. And if you look, you look at the nutrition facts and it says no sugar, but then if you look, 0 grams of sugar, but then if you look at the ingredients, it'll say sugar. Just not enough to measure it, but still there's sugar in there, so that counts, right? And so a lot of these things, if you just look at the nutrition label, it'll say 0 grams of carbohydrates. However, if you look to the ingredients, there will be sugar that is added in there. So it'll be a little bit, but still, sugar is sugar, and it doesn't have a place in most broths, bacon, or sausages, in my opinion.
How do you make yours? Just
whenever,
bones?
Yep. Anytime that we cook any meats that have bones, I save the bones. So if I don't make it, then I'll put them in a container and stick them in the freezer, and then I'll roast a little bit of veggies, and then I stick them in my Instapot, and then let it go. And then the seasonings, once it gets done, and I strain it. Sometimes I add ginger and turmeric. I always add garlic and onions in it. But I taste it till it tastes the way I want, and then I put it in little jars and stick it in the freezer. And the kids usually drink it faster than I can make it. So I try to have a freezer full, but I'll go to get one, and I'm like, oh, the kids have drank them all. Okay, well, that's fine. We'll just make more. Do
the animals get mad at you for using their bones, or do you still have enough?
No, I like to be like the Native Americans of, thank you for your service to my body, you wonderful animal that I just ate and nourished my soul, So, and there is actually a farm somewhere around here that kind of does that. They raise all of their animals very humanely, and they do a little bit of that, kind of telling the animal what they're going to do to them and thanking them for, giving their body and to the humans. And I think that, I'm an animal lover, so that touches me a little bit. So I think when you're eating an animal that was happy and lived out in the farm in their life, it's probably a better tasting protein.
It probably is.
But yeah, so, insulin, you release it. If you eat a lot of sugars and carbohydrates, you're going to release higher levels of it, and eventually you'll burn your pancreas out, and then, your blood sugar starts to go up. And I'm amazed at how many people don't really even know what their blood sugar is. And so I'll come in and I'll say, well, what was your blood sugar on your last labs? I'm not sure. That's a really important number. And so if you're, under the age of 63-ish, your blood sugar should not be above 80. Really, you want it in the 70s. And if you look at the lab test, it'll give you that normal range. In some labs, it's 100, and some it's 105, and maybe some it's 110. But for every point above 84, your blood sugar you have a 6% chance of becoming diabetic for every point. So if your blood sugar is running 99 and 100, you don't necessarily meet that requirement to be diagnosed as a diabetic, but trust that is too high. And so insulin makes you gain weight. Ask any diabetic who is on big doses of insulin. They typically gain weight. It is a pro-growth hormone. It does make you gain weight. So the best way to not gain weight is to lower insulin levels. So a lot of people walking around, they're heavy, their blood sugar is starting to creep up, and no one's ever looking at their insulin level. Well, trust that your insulin level is going to go up before your blood sugar does. Okay? And so as I'm a big fan of preventative health, because it is way cheaper to stay healthy than to treat an illness. And once you are diabetic, diagnosed as diabetic, they say, oh, you've probably been a diabetic for 10 years, you just didn't know it. Well, perhaps we should be checking insulin levels and catching these people way earlier so you can do something about it. Because if you can grab a high insulin level and work to get it down, then hopefully you'll never become a diabetic. Diabetics have heart disease and strokes and kidney failure and vision loss, and a thing that nobody really wants to talk about is dementia. High blood sugar and high insulin destroys your brain, and you really start to lose your memory when those things are both going up. So, yes, I'm a big fan. Don't eat sugar. I would like to say don't drink alcohol, but then that would be me being very hypocritical, because I do quite enjoy my red wine and bourbon on certain nights of the week. But truly, we need to limit our alcohol consumption. So some alcohol, it doesn't have a health benefit. There was a study that was just released that sparkling wines and white wines can help prevent cardiac arrest. And I was like, well, it really is it? Because it also increases risk of cancers, and it does raise your blood sugar, and alcohol use does help you not lose weight, right? It's harder to lose weight if you drink alcohol on a consistent basis, but there is some, it lowers stress levels, and, because it helps you relax. So on any given day, you can find good studies about alcohol, and you can find terrible ones as well. So I guess pick your poison. For me, wine is maybe my bad vice. I don't eat a lot of sugar. I don't eat junk food. I eat fairly healthy, so I feel like I can enjoy my glass of red wine. However, so please know what your blood sugar is. Pull up that last set of labs. Most of you guys have those online My Charts. Look and see what your sugar was. If it is 84-ish or above, have them check your insulin level. Insulin should be, a lot of people say it should be less than 10. Well, ideally, it should be between 4 and 6. And so part of the issue is it's just a recent transition of what really should an insulin level be. I don't think I've seen a single. And a lot of people bring me labs. A lot of people will come in with their labs for me to look at when we're talking about hormones or supplements. I have yet to see anybody have an insulin level checked.
I was going to say, I look at my chart, and especially right, as I get it tested a couple times a year, I don't ever recall seeing insulin.
Right, because it's just not a normal habit for doctors to order that. And so you have to ask for it. It's very similar to thyroid. Most doctors will check your TSH. Some of them will check your T4. A lot of them do not check your T3 and your reverse T3 and your thyroid antibodies. And a lot of times your thyroid antibodies will be increasing before you have thyroid problems. And so thyroid antibodies can be a sign of gut inflammation, dietary inadequacies with zinc and selenium and copper. So, if you check your thyroid antibodies, you also can catch thyroid illnesses before it happens. And so sometimes those labs are not normal. Like, for example, T3 is your active thyroid. So you can have a relatively decent TSH and a T4, but if you're not converting your T4 to T3, or if you're converting T3 back to T4 with the reverse T3, then it's not optimal. Well, because it's your active thyroid, T3 it should be checked, and yet a lot of insurances don't want to pay for you to check your T3. So some of it is insurance coverage. Insulin levels are something we actually can check through our testing that we do at the pharmacy. So I do have some women that when they check their hormones, there's saliva testing. We also have a blood spot test. And so with that, you can do cholesterol, you can do thyroids, all the thyroids, you can do vitamin Ds, you can do insulin, you can do C-reactive protein through this lab that we use. So there's some things that we can do that you don't have to do. So a lot of times when I have women that are really struggling with weight loss, we do the hormones, but we'll check an insulin level as well just to see what is it. And I did have one man who I checked his insulin, and he's been struggling with weight loss, and his insulin level is 26. Well, that's way too high. And so, and I hate to tell you, diet soda drinkers out there, if you're a regular drinker of diet soft drinks, your insulin level is probably high, because those fake sugars, aspartames, all of them, saccharin, the Splenda, all of them trick your body because they are so much more potent tasting than sugar is. They do cause your body to release insulin. And so a lot of people that drink diet drinks, your insulin levels are probably high. And then you wonder why you can't gain weight. So it's a twofold thing. We used to just blame the diet soft drinks, but it really is physiologic. They're raising your insulin levels. And so we don't want your insulin levels. Insulin levels that's where you start to have high cholesterol. Okay, so cholesterol patches inflammation, elevations of insulin make you gain weight, causes inflammation, and like I said, eventually will burn your pancreas out. And you also have to think, we've seen a few more cases of pancreatic cancer over the last few years, But if your pancreas is constantly overworking to produce insulin, is that contributing to pancreatic cancer? I mean, maybe. I mean, I don't know that, but it physiologically makes sense in my head to think if we don't force our pancreas to overwork, then maybe it'll stay healthier and less likely to get things like pancreatic cancer.
Here comes dumb question of the day, first one. Okay, so you have high insulin levels.
Mm-hmm.
What do you do besides diet change? Is there, how do you combat that?
Yeah, so we've talked about berberine a few times. Berberine is phenomenal to lower insulin levels. Yes, diet is the most important thing. Exercise will help to drop blood sugar. If your blood sugar goes down, your insulin levels should go down. But berberine is phenomenal. There's a little bit of research that curcumin can help as well. And there's some really good research between using curcumin and berberine together as just a really good anti-aging product to target overproductions of insulins, cholesterols, target your inflammation, because obviously with inflammation your cholesterol is going up. I hate to say this because I get fussed at when I talk badly about statin drugs, because cardiovascular disease is still the biggest killer of all the people in this country and across the world for the most part. But statin drugs, though they will lower your cholesterol, they do increase your blood sugar. It's very well known, and so I hate it because if you're diabetic, the guidelines are if you are diabetic, you have to be on a statin. Well, it just makes it harder for you to control your blood sugar. And so does it raise insulin levels? I'm not sure. We know that it raises blood sugars, and if you're on a statin, that you're more prone to it. Some people don't tolerate statins. It does deplete you of coenzyme Q10, which can give you very bad muscle atrophy, and even something as bad as rhabdomyolysis, which is where your muscles break down bad enough that they cause damage to your kidneys. And I actually have a lady that I know that had a horrific side effect to statins, and she's been struggling ever since. And and it's been years since she took a statin, but she still has kind of chronic pain and muscle issues from taking that statin. And so if we can get your insulin levels down and keep your blood sugar down and keep your cholesterol in a healthy range, then hopefully we won't need those. You know, I'm the fan of less drugs is better. Right? You're not healthier the more medicines you're on, you're sicker because they're going to cause side effects and other things. So if we can get you off of some of these medicines, and don't laugh, I take a lot of supplements. So some people's like, well, what's the difference in taking 10 supplements versus taking 10 prescriptions? Well, most supplements aren't going to cause you to be deficient in coenzyme Q10 and magnesium and all these other deficiencies that we see with common prescription drugs. But start talking to your providers, your PAs, your nurse practitioners, your MDs, whoever you go see as a primary care doctor, practitioner. Start requesting those insulin levels. And I'll be honest, like some of them may look at you like you're an alien. Because I even had a nurse practitioner who's like, well, what do you mean check her insulin? I'm like, check her insulin. She's like, what am I looking for? I said, well, you're looking to keep it between 4 and 6. And she goes, you mean a hemoglobin A1C? And I went, no, I don't. Hemoglobin A1C tells you has your blood sugar been running high or low for the past 3 months, but it is not the same as insulin. The levels you're looking for are comparable, but they are two totally different lab tests. And so you might expect that they might look at you strange. And they may have to look up how to draw it since it's not a normal lab for them, but you can order it. You can order it. And, I don't know how much it is to just I should have looked at that before I came up here. But if anybody wants to know what's it cost to just check my insulin through like one of our saliva testings, I can get you a price. I'll just have to look when I get back because I don't remember, because it's usually an add-on, to the other labs we're doing, and it doesn't take a lot. But I don't know if you can just check an insulin with them. Probably, because I know you can just do vitamin D. So I'll check with the lab and make sure, can you do just insulin or just C-reactive protein, or does it have to be added on to some other stuff?
But you can do that at
Mm-hmm. Yeah, so it's a kit.
Prescription.
Yes, it's a kit that you take home, and you actually do it at home, and then you mail it directly to the lab, and then I get the results. So then I would call you and let you know where the results are, give you a copy of your lab, send them to your doctor for you if you want. That's how we do with hormone testing. You come in, we test your hormones. I give you a copy of the results. We talk about the options for whatever hormone treatment you need, and the patient and I are like, which one would you prefer? This dosage form, this is the dose I think you need, and then we send it off to the doctor and go, this is the prescription that should correct these imbalances, and then they sign the prescription, hopefully. And so that's another thing. If you do hormone testing, make sure you have a doctor, because some doctors are not into hormone balance at all. And I don't know why hormone balance is such an amazing anti-aging. If your hormones are balanced, you're going to be healthier and happy for way longer than someone with not hormone balanced. And so some doctors, I think they don't know enough about it, and so they just kind of like, want to be that ostrich with their head in the sand. I don't want to do it at all. But I don't want somebody to spend money on a test if then their doctor is not going to approve a prescription. And there is a nurse practitioner here in town that does hormone work. She does take new patients. So, if you have questions about doctors who are willing to do it, we can help you find somebody that does. So, and then on another note, since we're talking about berberine and curcumin, I have what I think is Kentucky's most well-known supplement expert.
Yes, I've written my notes here to ask you.
Yep, Kathy Leet is 33-year certified clinical nutritionist. She has worked with Integrative Therapeutics, which is one of the best supplement lines out there. And there's other good lines, but Integrative Therapeutics is very meticulous. They have science to back up pretty much any product they have. A lot of these, like I'm getting all these questions about peptides, and so there's this huge push for everybody to take a peptide. Well, peptides are good for certain people, but there's not a lot of science that says everybody needs them. So you get a little bit of a glip of some cool product, and then they market the heck out of it, like that one probiotic with the Akkermansia that costs a fortune, but maybe you don't need to take just that one. So if they can use Google search about a supplement and they are trying to sell you something, and supplements can be life-changing. You want it to be a good product. And what I love about Kathy and Integrative Therapeutics is they are not going to recommend you something just to recommend it. Like, they really want it to work. And that's why if you come see us at the pharmacy and I talk to you and you do a supplement consult and I recommend a supplement for you, 90% of the time, if you take it exactly like I told you to and it doesn't help you at all, we're going to swap it out for something else or give you a refund, and their company stands by that. So then I just email Kathy and tell her so-and-so bought this bottle, this is what it was, and she will just send me another, a replacement bottle so that I can then refund the patient. So they're very good about it, but Kathy is an amazing wealth of knowledge. And like I tell people, I'd like to just live in her head for a couple of days. Like, I feel like I'm pretty good with supplements, but this woman blows my mind. When I ask her a question, and she'll type me back a novel of information. She's wonderful. So she's coming to town. She's going to try to come once a month, but her first day is next week, Wednesday, May 7th. She's going to be in Bardstown, Medica from 11 to 3. So you can just come in and talk to her about whatever issue you want to talk to you about. She's pretty knowledgeable about things that are not supplements too. So she's very good with stress and digestion and inflammation, but she just knows a lot more than I know, and so I'm excited to hang out with her and listen to her. So we'll both be there, but you do not have to be a current Medica patient. You don't have to take Integrative Therapeutic supplements. If you have supplement questions, come in that day and talk to her. Like, just walk in off the street and she will answer whatever questions you have. And we'll both be there to talk to people. If you are interested in supplements, we definitely can help you with that. But she's also pretty good about, I see people that come in and they're on so many supplements and none of it's quite in balance. And so sometimes she can go, you don't really need these. Let's narrow you down to these two supplements to save you time and money. And so she's there really good with that too. So I'm just, welcoming anybody. Do not have to be a Medica pharmacy customer. I know we lost a lot of our good, faithful patients because we don't take Humana anymore. But don't worry, supplements don't have anything to do with insurance. So it matters not your insurance, and it matters not what your current pharmacy is. If you have a supplement question, come by if you can. She's so good, and I think you'll be amazed at the information she can give you.
Okay. Has a wealth of health knowledge.
She does. She's amazing. She really is. So
Wednesday the 7th, 11 to 3.
Yes.
Okay.
Yeah. So.
We will remind her. And she's not going to do like a presentation. She's going to be individual.
Correct. Yeah, she'll just be talking to people. So, sometimes she brings samples of stuff, and sometimes she doesn't. So I'm not really sure what she's bringing. We didn't talk about the details. I just know she's coming earlier in the day to kind of chat with some of my staff and train them on some areas of stuff that they're interested in learning more, and then she'll be here to answer questions. Okay. So, yeah. So come on by.
That's good.
Yeah.
All right. So you done?
I'm done.
Sneezy time here. Says 6 sneeze-stopping strategies to beat your spring allergies. And of course, in Kentucky, we know we have a good one. Dr. Julie's 6 symptoms. I don't know who Dr. Julie is. She says, take a shower at night because pollen can stick to your clothes.
That's
so
true.
You're going to bed with pollen. So that's a good one. Let's see here. Daily saline nasal irrigation. talking with the nasal pot or
Neti pots are, yes. If you're an allergy sufferer, neti pots can be life changing. I personally hate them. Okay, I do not do well with them. I just squirt saline up in my nose. But neti pots and me are not friends. But I know people that swear by them and love them.
Okay. I talked with somebody yesterday who will remain anonymous, but they said they do that constantly, and that's been their saving thing. We were talking about sneezing, how some people sneeze once, some people sneeze twice in a row. And I think this person was like 4 or 5 times. I said, well, I'm in that range too. My wife says, quit sneezing. I said, I can't.
I know. I'm usually 3. Usually for me, I'm usually 3. Okay. Yes. I'll sneeze twice, and JT will just go, there's one more in there. I'm like, shut up. Yes, there is.
Oh, because if I say, I'm pretty sure incorrect. I say, if you try to stop a sneeze, you might blow your eyeballs out. Or pop your ears or something.
It's not comfortable to hold it in. Yeah. I'm a really loud sneezer, and so I hate sneezing in public because I'm one of those loud sneezers.
Let's see. Dissolve allergens with digestive enzymes.
That is 100% accurate. Yes, digestive enzymes can be game changers for people with allergies.
Okay. Is that probiotics?
So no, it's like it's digestive enzymes that help you digest food in your stomach. A lot of them will have acids or bile extracts.
Yeah,
Yes, and so killing off stuff before it gets into your intestinal tract can make a monstrous difference. Mm-hmm.
Yeah, and it says here, then the next one I should have read forward, reduce allergic reactions with probiotics.
Mm-hmm.
Okay, and go outdoors at the right time. Pollen counts tend to rise on dry, warm, and windy days, which could describe a lot of Kentucky days here. But
yeah, and it was very windy this morning. I had to actually, as I was leaving for work, and I was already running a little bit behind this morning, and my dad's garbage can had blown over and things were blowing down the road. So I'm running around the road in the wind trying to pick up trash and put it back in the garbage can and pick his trash back up. So yes, it was very windy this morning. Maybe that's why I had a little bit of a sneeze fit a couple hours ago. It could be. So
I kind of gather and put a ranking on the pollen by how green the table is on our back porch, the glass top.
Yes, green or yellow. Yes,
yeah,
one of the two. Yes,
it's a bad day because
you got the layer on your vehicles when you come out of work. You're like, oh boy. Yeah. You mentioned neti pot, so there's a couple things you can add to your saline solution if you tend to lean towards wanting to be a little bit congested. There is an herbal nasal rinse called Alkalol, Alkalol. It's got camphor and eucalyptus and menthol and some other things in it. So you can mix it with your saline and it will really open you up. It's phenomenal if you're kind of stuffed up. And then if you're prone to sinus infections, berberine, we talked about berberine for weight loss. So the berberine complex, which is an herbal, botanical, natural, antifungal, antibacterial supplement. If you open up a capsule and mix it in with your saline water, it'll help prevent and treat sinus infections, but it'll really open you up and clean you out. But yeah, that flushing, you get allergic reactions because stuff gets stuck up in the little hairs in your sinus cavity. So flushing out those sinuses, that's why the neti pot's so effective. But you can add things to it to make it more effective for whatever you need.
And nobody wants a sinus infection.
No, they don't. No, it's not any fun.
They're not fun.
I mean, I think I've only had one in my life, but it was pretty miserable.
Yeah. Well, anything else we need to talk about? And again, Wednesday, 11 to 3, next week at your Bardstown store, Medica.
Yep, that's right. And then, of course, it's Derby weekend, so hopefully all the horses get home. Hopefully you win a little bit at the track, but, the track always wins. So most of us are going to lose money. Next weekend is Mother's Day, and so if you are struggling to come up with something fun for your mom, we do have some new gift products in both Springfield store and Bardstown store. Bloomfield did not place an order, but there's keychains and candles and hair bands. Springfield has totally different stuff, but they have some cool things. We have some like Kentucky home wine glasses and cocktail glasses, some candles, some amazing foot creams. There's a foot cream we have that I'm telling you, if you've got rough heels, put it on, put a sock on, a couple hours later, you feel like you just had a pedicure. I love it. So if you're looking for something, swing by, check it out, or give us a call. We can throw some stuff together for you, and you can pick it up, and voila, Mother's Day shopping is useful, cute, and done for you.
Yeah, and while you're in Wednesday, you could do all that.
That's right. That's right.
All right. Well, thank you very much for a very informative show today.
Yeah, you're welcome.
Okay. This is recorded. You'll be able to watch it or have somebody say, hey, I need somebody to see this. It'll be available online. Just keep watching the Facebook on WBRT and WOKH and also Nelson County Gazette. And when it's posted and up, you'll see that notification. Take care and happy Derby. You have a horse?
I haven't even looked. I'll figure it out Saturday morning.
Gray
Probably.
horses don't mean anything to you?
There's been a few gray horses that won the Derby, not, but I know that Sandman is a lot of people's favorite. I have not I like to watch them run, and I like to look at their numbers, especially which horses run the last furlong the fastest, because in the Derby it's about closing at the end, almost always. So I want all the ponies all weekend to come home safe. That's all I want.
That is For Your Health from Medica Pharmacy. We'll do it again in a couple of weeks right here on WBRT Radio. Alyson, take care.